Hello, welcome to the TanzMed, a digital healthcare, which is simplified healthcare accessibility across Africa. In this demo, we are going to see what is TanzMed and what you can do with the TanzMed. It's going to be very fun, so let's get started. So to check the TanzMed, first of all, TanzMed is available in both English and Swahili, and it's available in Android and iOS. So the first stage, you have to get the TanzMed. You download the TanzMed. After downloading the TanzMed, you register the TanzMed. The good thing of TanzMed, you can register with the TanzMed either using your number, so that you can get the RTP from WhatsApp number, or you can get it by SMS if you're in Tanzania or in Kenya, because there are some countries, they need registration for SMS, so we skip this by integrating with the WhatsApp. So after registration of the TanzMed, this is how you see the TanzMed. As you can see, when you click here, you can see your profile, your favorite. The favorite here, if you stop anything, for example, I was reading the article and I think this article is very useful, then I can install my favorite. And at the same time with the medical records, which we are going to integrate with our AI-powered facial selfie. The terms, the privacy about TanzMed, you can contact us and you can set the setting and manage the way how you receive notification and how we handle your data. At the same time, the TanzMed allows you to change the language. You can choose from Swahili or in English. And what is very nice for the TanzMed, we have made it to be everything will be changed online. So it changed from where you are. So for the demonstration and everybody to be aware, let me take it in English. And here you can share the application so that other people, they can see the application. So going to the TanzMed, as you can see, the first part here, this is our AI power with the Amina. You can chat with Amina using any language in chatting Swahili or in English. And also Amina allows you to have health assessment either yourself or the other person. This is very crucial for the developing countries like Tanzania, because if you use this one, you can also do for your friends, for example, in remote areas whereby mobile phone accessibility is not very much. So if in your house one person has a phone, they can use it to have assessment. So if you do assessment, like I do for myself, it's very easy. You can just do just like the normal chat. And when you are doing the chat, you can say, yeah, you can do like that. So after finishing the chat, what it tells me to do, it can assign what the conclusion is. It can either direct you to talk to the doctor, to chat with the doctor, to read the article, or to book an appointment. So the second part of Tanzania is consultation. So here consultation, we have two ways. First, you can talk with the doctor. So to talk with the doctor, meeting is a video conference. We have more than 70 doctors who are available on our application. And the price for every doctor, it depends to the specialty and years of experience for that doctor. And you can filter doctor using categories here. So whatever you choose, that doctor will come. Or you can find a doctor here. Or you can come here and you can filter a doctor based on a lot of factors. I can filter based on my location. I can filter based on the price here, the price I'm choosing here. You can filter based on specialty. You can filter based on the services, based on the insurance, or even based on the rating. Not only that, when you pick the doctor, like Dr. Majend, then I can choose the date. I can select the time. I can select here, how many minutes do I want to have conversation. And here I can choose the services. For example, here we have two services. One is live call, the meaning you can talk to the doctor online. And the second one is free, which is to see the doctor or book appointment. And I can see the doctor at their press. So when I go here, I have it to cut. After confirming everything is fine, then I can go and pay. So what does make it very unique? Everything, we have the wallet inside. We call it Health Wallet. So without the Health Wallet, if you don't have enough balance, you can pay using your wallet. But if you don't have, you can top up the wallet and pay through the wallet. So here I can top up through the wallet. And it's very simple. You can use 075356. One thing you can also use here, you can also use this as for the Visa, MasterCard, and other payment gateway. while these are for the normal services, which are mobile payments, which are available here in Tanzania. For example, I use Pesa. I put my number 0753561123. And after that, I can just put here, I can confirm. So once you confirm, it just pops up on your phone, and you can just put the PIN number to make the payment. You see? Enter PIN number to support and pay. So when I put the number here, it's done. So that is how to make payment and pay using the TanzMed. After that, the second feature, which we check, is like also the chat. You can also chat with the doctor. I can go here, and I can just pay paper chat, because I'm the regular member. But for the premium member, they're getting free chat. You can also come here, and you can find a hospital, and you can book appointment to the hospital. So the appointment with the hospital, you're not booking appointment with the hospital. You're booking appointment with the doctor from that specific hospital. So we have a lot of categories. We have hospital, polyclinics, health center, pharmacies, and etc. Another thing we have is for the pregnant. This is very clear. This is very crucial. But before going to this, let me go to the women half. Because in the women half, we have this, the first part where the women can follow the menstrual. They can see their progress. They can see the calendar, which days are fertile, which days are safe. They can also edit their menstrual. They can be notified on every change on this cycle. So you can be notified, like today you are going to have period, how many days before period, and everything. So we are making these women, in every stage of their cycle, they get notified through Tanzania. And at the same time, they can talk with the specialists who are gynecologists, or they can chat with those gynecologists. And here they can do assessment for the pregnant. We have questions, and after this question, our AI tool, they can analyze, and it can do prediction of your chance of having a pregnancy. We have here also, this for now is an article, which explains, like if the women, to understand the vaginal discharge, in the very near future, this tool, it will be the AI part. It can take a picture, and it can analyze with the women corner, and also we have the pregnant tool. So after pregnant tool, because the menstrual and pregnant tool, they cannot coexist. So if I ask for the pregnant tool, for example, I go to the pregnant tool, and I put when was my last period, I say it was August. And when I calculate, the tool will calculate and let me know which week I am right now, and I'll be able to see what are the characteristics for that week. I'll also be to make the progress here, to see what the progress of the baby, what the early sign, what is the dangerous sign, if I see any other thing. Not only that, I'll be able to talk with the doctor. I'll be able to see, for example, this part, I'll be able to see when is my due date, the day which I'm expecting to deliver. We have also articles, which are available in languages, different languages, but for now, mostly in Swahili. And here, we have the clinic. If you want to visit a clinic, this is the first time. For example, for the women, pregnant women, the advice to start clinic area. So when you start the clinic, you can add a clinic, and you'll be notified whenever clinic date. And at the same time, you'll be reminded here, what did you do? For example, here, I put, this is hospital. I put the day, whatever, and the time for that. I can put the doctor's name. I can put the name of the father. And here, I can put the phone number of the father. And not only that, I can also select what we've done, and from the Ministry of Health, there are recommended tests, medicine. For example, let me put, you can see some details. They will have drugs, put those data, include father. With this feature, you can make your partner so that he can get notification on the clinic date. And at the same time, the partner will be able to make a follow-up of what's going on. And when you go to the clinic, you'll be able to select if the father was also available to the clinic. And if you have any clinic date, you'll be able to select what the clinic date. And then I choose everything. And after that, I'm done. And I can save. Okay, the phone number, 075-356-1123, not 075-356-1123. I'm done. Yes. Hurrah! This is a clinic. It's been completed. And as you can see here, it tells you what medication you have taken, lab medication, and what vaccination. And when you click, it will tell you all available vaccinations and which day you are supposed to get that vaccination. Not only that, also that for medication, it is for vaccination. So this one, it takes you through all available vaccinations, which are recommended by the Ministry of Health and the WHO, which you are supposed to take based on your week. And not only that, going down there, you can see if you go to the clinic, if you select here the meaning you have attended this clinic, and then we will ask you what tests have you done based on that week. So these tests are coming depending on the clinic day. So there is a lot of things you can do here. You can do, and once you finish, you can cancel that pregnant and now going again. You can also have the HIV ads, and we also have the pad for the mental health. So for the mental health, it's another thing. This is another Amina. It's AI powered. You have assessment. You can do assessment. You can also, here, you can track your mood. For example, today is very good. I feel so good. I feel so good today. Yes. You can add. And once you add that, you can also have consultation with the mental health expertise. It's the same. When I come here, I just see the mental health expertise. I can talk, I can see the price, and I can book appointment in the video call, or I can chat with the specialist who are specifically for the mental health. Not only that, here, you can follow your mood. As you can see here, I have 3 dots. When I go here, that is my mood was terrible. Here, my mood was terrible. But today, my mood is good, and I can see why good. And this is very useful. For example, you can go to a specialist or a professional, and they can allow you to track your mood. So when you come back, they'll be able to make follow-up to see the progress of your mood day after day, month after month. Not only that, you can have activities. For example, you can create a goal. When you're chatting with Amina here, for the mental health, Amina, it can create the goal. For example, when you chat with Amina, and you recognize you are passing through stress, then there is a simple cognitive behavior therapy, which you can do to overcome stress, and that is coming to goal. So you can create a goal. For example, I can create a goal for the goal. So here, select the challenge, because these are the main challenges for the mental health for now, which we are covering. For example, we have Sonona, which is depression. So here, you can enter the hints. You can see your goal, when you want to start, and when you want to end that goal, because maybe I want to end that goal January next year, I can select. And when I'm done, I can submit to overcome stress. And when I'm done, now I can add now activities. So all the activities, I can select. This is social. I can add the activity. I will be doing these activities. So this is another way to allow you to make it follow up with your activities. And you can come here, and you can see all available activities in the mental health. And you have a lot of news you can read. Not news, you have a lot of articles you can read. And what a good thing, once you read the article, which are written by a specialist, here, you can also come and book an appointment with this doctor who wrote that article. You can also favorite that doctor. And so when I come here to my favorite, I'll be able to see Dr. Ladina is in my favorite. So the task is very comprehensive. We have the tools for the nutrition. We have articles on nutrition. You can count everyone. And here, you'll be able to see your weight trend month by month by month by month. We also have the tool for the notification. You'll be notified for everything what's happening there. You'll be able to search, for example, is your calorie, is diabetes. I can be able to search, and it gives me a lot of articles, which you can relate to, related to the calorie. Not only that, the task, maybe, it's also allowing you to manage your profile. So when you come to my profile, you'll be able to see your activities, your medical records. You will be able to see your balance. Coming to my balance, you can be able to top up your balance. And you are the regular member. You'll be able to change your photo. Okay, now, but I don't want to do this, and you can do it. But for now, for the Android, for the iOS, we don't have the subscription model. But for the Android, it's available because due to the iOS restriction, which forces you to use in-house purchase, so we are opting a user to go through the credit system. So that is all in action of TanzMed, what we do in TanzMed. As you have seen, you can talk to the doctor, you can do a breath assessment for yourself, and you can do a lot of things for your good health. I hope this was informative, and thank you, and enjoy the use of TanzMed.